I was badly off, my uterus was going to burst.
Painful periods, medically known as dysmenorrhea, are often misunderstood. While some girls and women experience mild cramps, others suffer from severe disabling pain that affects their ability to function daily.
I got my periods when I was in primary 7. I had experienced pain earlier, like 3 days before, but I never knew that I was going into my periods. I just thought it was pain where I had ulcers.
Stella Nakato remembers vividly the first time the pain hit her.
The pain circulates the entire body. At first you can feel it there. You feel pain and the pain keeps on circulating. The way you can lose control, it is everywhere. You can't know whether it is in the brain or in the hands. You don't want to talk. You feel like no one is understanding you at that particular point.
What began as early menstruation quickly became a lifelong battle. Her pain wasn't just monthly discomfort. It was extreme weakening pain. At times, it left her numb or unconscious. But despite how serious her symptoms were, she was met with disbelief.
The pain kept on and kept on increasing every now and then until I saw blood. That's when I realized that I was beginning my periods. But then I was rushed to the sick bay. But the nurse never knew the root cause of that severe pain.
Doctors repeatedly told her she had infections. Some even accused her wrongly of being sexually active.
From 2003 up to 2015, I was misdiagnosed. And I met a certain doctor, a guy, who worked on me, and I opened up my eyes. I asked him, sincerely speaking, from this month to this month, you're treating infections. And the infections that you're treating, they are not going.
However, what Nakato was experiencing is not uncommon. Experts warn that while period pain is normal, to some degree, there are red flags that indicate something more serious. These include severe cramping that disrupts daily activities, heavy bleeding or periods lasting longer than 7 days, spotting or bleeding between periods, pain that requires regular use of strong painkillers, nausea, vomiting or diarrhea, dizziness or fainting, headaches, pain during intercourse. When these symptoms are present, health professionals say they should never be ignored.
If the pain warrants that she gets some treatment, medication for her to function, or if it demands that she does not go to work, that is a concern. It may show an underlying condition. There are many things we think about. Some of these things like infections. You know, somebody may have had infections and now they have scars inside, and if they get periods, the periods will be most likely painful. But now we're seeing more and more painful periods coming because of some condition called endometriosis.
Nakato isn't alone in her experience. Grace Nagawa began menstruating at the age of 14 years. And from the start, her symptoms mirrored Nakato's severe pelvic pain and monthly cycles that left her physically drained.
Like any other girl at home, usually parents tell us, you know, when that time comes, you have your periods, you have to let your parents know. And usually they tell us it has to be normal, the flow should be normal, and you would take like 3 to 4 days. And of course, someone has to see red blood and all that. So that was the preparation by my mom. So when I clocked 14 years, but then I was in primary 7, that's when I had my first periods. So for me, it was not red blood. They were just dark black spots. And it was so painful the first day. Like I had severe cramps along with diarrhea. So I had to leave school that very day and went back home. So because it was black, so my mom was like, oh, is this your period? She had also never seen that. She's a nurse, but she had never seen that. So I started taking painkillers at the age of 14.
She spent much of her school life in isolation, too ashamed and exhausted to explain what she was going through.
Life wasn't easy because at school I used to believe, like, I tried asking my colleagues, do you people go through this? And none of them would go through that. At times they go out, play and do a lot, but I used not to socialize a lot because most of my time, I used to have that pain. At times you're not in your menses and you have lower abdominal pain.
Like Nakato, she was often given painkillers.
I used to take Panadol every day. Diclofenac stopped working. I started taking ibuprofen. Ibuprofen, we call that an NSAID. These are anti-inflammatory drugs. Like, it helps to calm down the pain and also reduce inflammation. But in a long run, it causes ulcers. So I started having epigastric pain. And then the pain was so intense that now I had to switch to injectables. So I'm this kind of person who used to black out on injections. Like, when you give me Diclo, Tramadol, I just black out.
Years later, her suffering led her to pursue a career in medicine, a personal mission to find answers not only for herself but for others like her.
As I was trying to move around in the hostel, I just felt paralyzed. I just lost conscious and I found myself in the hospital. So at that moment, I was bleeding. So when I regained conscious, so the doctor asked me, what's wrong with you? I told her I've had pregnant symptoms for years. So she didn't even wait for me to explain. So she told my colleagues, I think she's trying to abort. We know you students, you do abort. She's trying to abort. Just take her, do an SCG, and then come back here. I just told my colleagues, let's go for a scan. So they carried me to the scan room. And to realize I had 2 huge masses, and one of them had burst. So that's why I was bleeding.
In her search for relief, Nagawa saw numerous specialists and went through repeated misdiagnoses, but the pain never went away, and sometimes it was life-threatening.
So that's the pain I had. Like, I couldn't even walk in pain. So we went back to her, and that's when on showing her the scan results, she just apologized and then did an examination and called in a gynecologist. So I sat with a guy who told me, Grace, these are cysts. We shall perform a surgery and everything will be okay. You know cysts. So the following morning, I went for this surgery. It was around 9 a.m. and I came out at 3 p.m. So now during the recovery room, when you're in a recovery, you're trying to regain consciousness. I started hearing voices of doctors and nurses like, oh my God, I've never seen this in life. Everyone was saying, I've never seen this. So when we went back to the ward, I started asking the nurse, what did they find in me? What did they find in me? So everyone was like, Grace, this is a condition we've never had.
This excruciating pain was later linked to a condition known as endometriosis, a chronic illness where tissue similar to the lining of the uterus grows outside the womb. It affects millions of women worldwide, but is often diagnosed late due to a lack of awareness and limited diagnostic tools.
Endometriosis is a condition which I believe has been there in the population, but just that we didn't have the tools and the knowledge to identify these cases. But it's now very common, and you typically presents with very painful periods, and typically these period pains continue to get worse and worse over the months and over the years. And so you find it can become so debilitating, and it can even graduate into infertility later in life. So this is one of the things. Painful periods will never be ignored.
Dr. Joseph Muhumuza, a gynecologist and fertility specialist, says the stigma around menstrual pain combined with misinformation leads many girls and women to suffer in silence or to be wrongly treated for years.
Normal cramps during menstruation are okay. Normal cramps which you can maybe brush off with not necessarily having to take a painkiller, or maybe your hot water bottle is enough to just ease the cramps. Those are normal and those are expected. But in cases where you find that these menstrual cramps are progressively becoming painful, the pain you were getting 5 months ago is getting worse now. The type of painkillers you're taking is getting stronger. You are taking Panadol, now you're on Tramadol. You need to combine it with Diclo. that is not normal. Something is going on. And those menstrual cramps have to be investigated.
Nakato and Nagawa are among many women who live with pain that was not only untreated but disbelieved. For them and for many others, what was labeled as just period pain was actually a serious medical condition. In part 2 of this series, we follow what happened after their diagnosis and why for so many women, getting a name for their condition is just the beginning of another long and painful journey involving costly treatment, unnecessary surgeries, and an unprepared health system. Betty Mudondo, NTV.